Emergencies that may arise during dental procedures. Emergencies can be of various types, such as sudden loss of consciousness or collapse, chest pain, difficulty in breathing, convulsions, and other emergencies. Again, each of this can be due to various reasons. For say, sudden loss of consciousness or collapse, it can be due to fainting, acute hypoglycemia, circulatory collapse secondary to corticosteroid therapy, anaphylactic shock, myocardial infarction, cardiac arrest, or stroke. How to figure out what is the actual cause? There, you have to rely on the history you have taken and also the signs and symptoms. The patient is undergoing a fainting episode. The causes can be transient hypertension or cerebral ischemia, and there can be numerous predisposing factor. For say, the patient is anxious about the dental treatment, or he or she is undergoing pain, infection, fatigue. Again, hunger also can be a cause of loss of consciousness, and the signs and symptoms include premonitory dizziness, weakness, or nausea. And when you see the skin will be pale in nature. Also, to the touch, it will be cold and moist. Initially, the patient will have slow and weak pulse, and it will become full and pounding, and the patient can lose consciousness. How to manage? Lower the head and preferably lay the patient flat. Loosen any tight cloth around the neck so that the patient is having a proper airway. Give a sweetened drink when consciousness is recovered, and if there is no recovery within few minutes, consider other causes. Other causes include hypoglycemia. So, hypoglycemia, the signs and symptoms are almost similar to fainting, but even when you lay the patient flat, there won't be much of a response, and the unconsciousness will steadily deepen. So, how to manage? First of all, the patient will be aware of this condition and they will be warning the dentist. So, before the consciousness is completely lost, give glucose tablet or powder or sugar, at least 4 lumps, as a sweetened drink, and repeat it if symptoms are not completely relieved. Ideally, if consciousness is lost, then you can give IV glucose. Okay, IV glucose up to 50 ml of a 50% solution, and if sterile glucose is not available, you can give subcutaneous glucagon 1 milligram, and then give sugar by mouth. So basically, if you have sugar, try that before loss of consciousness happen, or else if the patient is unconscious, then give sterile IV glucose. If not, subcutaneous glucagon 1 mg, and hypostop, that is a gel containing glucose. Again, that can be given. If the patient is declining consciousness, then you can try giving hypostop, which is a oral gel. Corticosteroid related fainting. Sometimes the patient will be undergoing a corticosteroid therapy, and here the signs will be pallor and rapid, weak, or impalpable pulse. Then there will be loss of consciousness, and BP will be rapidly falling. How to manage? Lay the patient flat but raise the legs and give at least 200 mg hydrocortisone sodium succinate intravenously, and always make sure you're calling an ambulance because it will be necessary for a fully supported medical treatment, and give oxygen if necessary. Also consider other possible reasons for loss of consciousness. Next is anaphylactic reaction. Anaphylactic reaction will have an entirely different signs and symptoms. That will be facial flushing, can be there, itching, paresthesia, or cold extremities will be there. Facial edema. If you see edema, flushing, or itching, consider anaphylactic reaction. Then there can be bronchospasm or wheezing, loss of consciousness, then pallor going on to cyanosis. Initially there will be a flushing, then pallor, then cyanosis, cold and clammy skin, and rapid, weak, impalpable pulse can be there. Also, BP can be rapidly falling. If treatment is delayed or inappropriate, death can even occur. So, the management is to lay the patient flat and raise the legs to improve cerebral blood flow. Now, give 0.5 to 1 ml of 1 is to 1000 adrenaline by IM, and repeat this every 15 minutes if necessary. Also, you can try giving 10 to 20 mg chlorpheniramine, that is diluted in a syringe. You don't give it directly, give it diluted in a syringe with 10 ml of blood and slowly IV. Or other option is giving 200 mg of hydrocortisone sodium succinate IV and give oxygen if necessary and call for an ambulance. Next is cardiac arrest. Signs and symptoms will be sudden loss of consciousness and absence of arterial pulses, carotid artery or anterior to sternocleidomastoid. Management is by CPR. We have done a detailed video on how to give CPR. Please check it out. And the last one is stroke. Patient can lose consciousness due to stroke. Here again there will be loss of consciousness and weakness of an arm or leg on one side, drooping of side of the face, and also sternness breathing. Management is by maintaining airway and call an ambulance for transfer to hospital. So that's all, and wait for part 2 detailed video on rest of the emergencies which can occur in a dental clinic. Don't forget to like, comment, share and save this video. Thank you for watching.